So my name is Dylan Kuntz. We're going to be doing some non-thermal ultrasound on our patient today who had a lateral ankle sprain a couple days ago, I believe. Some indications for this patient is to regenerate some of that tissue for tissue healing because he had an acute injury and for some of his pain. Some of the contraindications for this patient is pacemaker, but we're nowhere near the pacemaker, so it should be fine. Some decreased sensation, decreased circulation, and I think that's, and for if there's any clots or any blood clots or malignancies. But yeah, that's about it. And he's also in phase 1. He's in the inflammatory phase. Okay, Ronnie, my name is Dylan. I'm going to be doing some ultrasound on your ankle, which you just injured a couple days ago, correct? Mm-hmm. So for this, can I actually we'll have you face this way and I'll have you put your legs down here. So you can be seated, just like a long sit. Perfect. And before we start, I'm going to have to place my hands on your ankle so we can do the process and I can feel that tender spot. Is that okay?
Yeah.
Is it okay if I take your socks off as well?
Yeah, you want me to take it off?
Yeah, if you could. There's no pain with that. Turn this on real quick. Okay, so for the ultrasound, let's have this turn on. Okay, so we're going to be doing sound. So for this one, we're going to be doing 3 megahertz because it's a very superficial tissue. We're going to be doing non-thermal, so we're going to be doing 20%. So for this, normally it's about 5 to 10 minutes for the treatment time, but for this case, for the assignment, we're just going to be doing 20 to 30 seconds. And I think everything else is good. So for intensity, we're just going to be doing 0.5. And let's see. Actually, can I actually have you face the other way, Brace? Sorry. Just so I can, don't have to move this. You good? Is this a good angle for this part? Okay. So I'm going to put this gel. Okay, so we're going to be doing ultrasound. This is just going to help with some of your pain. It's also good for acute injuries to help with that tissue. We want it to really try to get strong again and to regenerate. Before I do that, I just want to make sure you have some have you ever had do you have bad circulation that you know of?
No.
I'm just going to do a quick test just to make sure. So I'll do the Blanche test, make sure it comes back to the normal skin color in a couple seconds. So you do have a pacemaker, but we should be fine in this case just because of how far away we are from it.
Okay. And
there's no infections, malignancies that I can see, so it should be fine. I'm gonna apply this gel onto you real quick. This is gonna be real cold, so. Turn right there. Is that comfortable?
Yeah, that's fine.
Okay. Okay. Take this out. Alright, so I'm gonna start rubbing it in. Quick start. Okay. Is there any pain with this?
No.
And for this, for the ERA, we're trying to just do 2 to 3 times the radius to get as effective treatment as we can. Okay, and that should be good. I'm gonna hit stop. Take it off. I'm gonna wipe that down for you real quick. Okay, and then I'll assess his skin real quick. There's no redness, no burning sensation right now.
No, it feels
no
fine.
pain either.
Yeah.
So it should be good to go. And I'll finish wiping this up.